Understanding obsessive compulsive disorder. Obsessive compulsive disorder, commonly known as OCD, is a serious but treatable mental health condition. It is often misunderstood as simply being too clean or too organized, but in reality, OCD is much deeper and significantly affects a person's life. So, how do we understand OCD? OCD consists of two main components. Obsessions, which are recurrent unwanted thoughts, images, or urges that cause anxiety or distress. Second component is compulsions, repeated behavior or mental act performed to reduce that anxiety. A person with OCD doesn't enjoy these thoughts or behavior. So actually it causes a distress and they are unwanted thoughts. So obsessions are fear of contaminations, germs, dirt, fear of harming oneself or others. Intrusive, disrupting thoughts which can be violent, sexual, or religious type. Excessive need for symmetry or feeling that you need to do the same thing repeatedly, again and again. Repeated hand washing or cleaning, checking, locking doors, appliances, checking, and then counting, arranging items in a very specific order. So, how do we understand OCD? It's important to understand that OCD is not a personality trait or a habit. It's a medical condition. A person knows the thoughts are irrational, but still cannot control them. The cycle is that they experience obsessions that leads to anxiety, hence compulsions that they have to repeat those behavior, and that temporarily relieves that anxiety, but the cycles then repeats with obsession. And it can be very exhausting and time consuming. It impacts on life in a very negative way. If untreated OCD, it leads to severe anxiety, stress, difficulty in work or studies, strained relationships, depression, and reduced quality of life. So what are the main treatment of OCD? So main treatment is psychological therapy. First line treatment, which can be very effective, includes cognitive behavior therapy called CBT or exposure and response prevention. In exposure and response prevention, patients are gradually exposed to their fears. They learn to resist performing compulsions. Over a period of time, anxiety reduces naturally if they know how to resist compulsions. Then comes medication, which are mainly to help reduce severity of anxiety and to reduce the obsessive thoughts, which are SSRI type of antidepressants called selective serotonin reuptake inhibitors. And the examples can be fluoxetine, fluvoxamine maleate, sertraline, or escitalopram. These helps reduce obsessive thoughts and anxiety. The best is combination therapy, and the combination means combining medication, which are SSRI antidepressants, with cognitive behavior therapy. So my message to public is that number one, OCD is not a weakness. It's a treatable brain-based condition based on neurochemical imbalance. Early recognitions can lead to better recovery. Support from family is very, very important. Avoid criticizing or forcing the person. Instead, encourage professional help. If you are suffering or someone else is suffering from this illness and have these repeated unwanted thoughts or behaviors, please seek help early and recovery is possible. My name is Dr. Shafiq Yasin. I'm a consultant psychiatrist and I hope this video is valuable.